My name is Penny Allen. I represent Briova RX Infusion Services. I'm the National Director of Nutrition Support Services for the company. Briova chooses to work with the Oli Foundation because a number of us have been in home infusion for a long, long time and help to care for consumers and their families that are home on parenteral and enteral nutrition. I personally have worked with the Oli Foundation for greater than 25 years, and I can see the value and the benefit that comes to the patient and their family with the need to connect to other people that are going through some of the same types of things that they've gone through. For example, one of the earlier Oli meetings that I attended, we convinced a long-term patient to come to the meeting. It was in Boston. And in the middle of the meeting, she said to me, "I thought I was the only person in the whole world that had to go through this. I never knew there was a whole group of people out there living through what I've already lived through." So that's our dedication, is really to support Oli, support their endeavors, and make sure we can do as much as possible to help with the mission. I think that working with Oli gives us that stamp of authenticity within the nutrition support arena, clinically, within the business world. There's such a strong organization in terms of patient advocacy. It's just where I personally would like any company that I work for to be aligned with that type of mission. We tend to get involved with anything public policy related. I know there have been times where I've abbreviated an article perhaps that was published on reimbursement. So we're really strong in the way of advocating for appropriate reimbursement for consumers and their family. So anytime Joan or Lisa, any member of the team asks us to get involved, or perhaps could we write a short piece for education, whether it be about parenteral nutrition, traveling with parenteral nutrition, reimbursement, whatever. I mean, I feel like part of our mission is to give back on the educational side of things. But if there's any way that we can advocate, I'm involved with other committees with Aspen, as is my company, and a lot of the missions or goals are aligned. For me and the company, in every year, we probably have at least 3 or 4 other representatives attend the meeting. It's almost like a bucket of ice cold water that gets dumped on us to say, like, in case you forgot, in the thick of all the busyness of caring for patients or programs or whatever, like, this is what it's all about. So the annual meeting, for me personally, the In Loving Memory ceremony, as sad as it is, that's the take home of, like, some of these people have been able to live as normal a life as possible, despite the fact that they have to hook up to something every single night and live with a chronic disease. So I think, and the dedication of the Oli staff, they are the same people that I've known for greater than 2 decades. So their continued commitment to Oli, I think, is incredibly meaningful, that it's the same core team of people year after year that are here, just reaching out, expanding the mission, and trying to reach anybody that needs help or that needs support. The one patient that I recall, which was one of the first meetings we did greater than 2 decades ago, having someone say, "I thought I was all alone and I was the only person in the world that had to live through this," for that patient, that meeting was incredibly eye-opening. For a couple of decades, we've taken care of adult patients, pediatric patients, or whatever, but to see some of the families that have come here year after year after their own children have passed, and then they've taken on other children, taken in foster children with some of the same needs, that to me is just an incredible testament to humanity, to those people and how big their hearts are. And it's the same core group of people, but the expansion of Oli over the years, that's been really rewarding and exciting to see. Oli has been very helpful to many of the consumers that I've met and been connected to over the years. I've been in home infusion, as I said, for over 30 years with 2 or 3 different companies. So to see the populations, that when the children started as babies and had congenital anomalies and they were on multiple therapies, and now when I come back to see how much they've grown, how great they're doing, that is incredibly rewarding for any clinician that has had the opportunity to do that. There's families that we've known now for 10, 20 years, to see how they've succeeded in working, whether it's parental nutrition therapy or enteral nutrition therapy, into their life, into their lifestyle, into school, work, play, whatever the case may be, travel. We had a young girl who went to London on a semester away who was a lifelong PN patient. So being able to pull in resources from OLI to help assist with how could we make this possible with customs and so on forth, and have her be able to go to London, England for 4 months or so. And we made that happen. If we didn't have the resources of OLI to be able to assist with how do we travel, how do we deal with customs, how can we convert her prescription. So that's really, you know, she just wanted to go for a semester away in Europe like every other college student. So it's stories like that that are incredible. And I think without the support of OLI, making that information known out there, you know, children, young adults, and other patients couldn't do what they really want to do with life. If you know anyone that is reliant on parental nutrition or enteral nutrition, please go to oli.org. They provide so many different resources for families, for consumers, for patients, for even physicians and clinicians in terms of how to deal with a complex therapy, how to advocate for yourself, how to be your own best friend in terms of negotiating the healthcare system. They're a great organization of committed individuals, and anyone who has to be on parental or enteral nutrition, whether it be for the short term or the long term, should check out the OLI Foundation and see what's available to them. I can't speak highly enough about OLI. I love the people that work here. I love their dedication. I love the mission. I love coming to these meetings every year and seeing the children run around, some of the older patients. I just can't speak highly enough about the OLI Foundation. And for me, in my career, this is incredibly rewarding as a clinician to be aligned with this organization. It feels like family. It feels like, it sounds corny, it's just the best group of people, honestly, that you could align yourself with if you're at all involved in the nutrition support world.